My dear aspiring doctors, you are listening to Dr. Ratan Salecha from mycareershapers.in. Our team of career shapers from past 1 decade has successfully mentored thousands of aspiring doctors to take up a seat in a medical college of their choice and of their budget. In today's video, we are going to talk about how to get a medical seat in a good college in your budget. It is very important to make a note of all these points which I am going to talk to you about. Irrespective, I don't have to tell you much about, to get a good medical college, first and foremost required would be the marks, and they will also decide how good a college you get. But it is not always the marks. Many times, people who have scored average marks also can get into a good college, and for that you will need a good coach or a mentor or a team of people who can help you. You will need planning, and you should do your budgeting much in advance. Have knowledge about different colleges and documents required to get a particular medical seat. So we'll discuss one by one how a coach or a medical mentor or a team can help you out. These are the people who will actually tell you what are the good colleges all over across India, what are the different kinds of counseling procedures which can help you out there, and with their help and with the respect to your own predicted marks, expected marks, or the marks you have scored, you can actually plan which are the colleges available for you, and based on that you can decide, yes, I would like to take up that college, or no, I don't want to take up that college. This is the way you should plan your counseling procedure much in advance. Coming exactly to the planning part of it, it's a saying that 11th minute work will always lead to confusion, anxiety, fear, and this confusion will always, and not always, most of the time leads us into taking a wrong decision. So all the hard work which has been done for past 2 to 3 years to get into a medical college, one mistake, because of anxiety, because of confusion, you might lose a seat. This planning, don't wait after the exams get over. Don't wait. I will think about the counseling only when I get my results, only when I get my rank. We as a team, you as parents and students should sit together and plan everything very well, which are the colleges available for you, so that your counseling procedure is absolutely peaceful when you go there, and that peace will help you to increase the chances of getting a college. Thirdly, the budgeting part of it. Every individual or every rank is a different case study. So budgeting will not depend on what are the colleges available for you. Budgeting will depend which are the colleges you can afford. So we should have a rough idea about how many kinds of counseling procedures are there. What is an all India quota? Other than that, which are the different states where I can enter into a private colleges? Thirdly, we should compare all these private colleges and the deemed universities. All these private colleges and the deemed universities, they come with a different budget. So you can sit together and work on, yes, at this particular marks, these are the ranks available for me, these are the colleges available for me, and this is my budget to get into the college. So let us take an example for this. Okay, last year, we had a student called Prithvi Singh. He got very good marks, but he was not aware about his budgeting, where he wanted to go. So while doing this, in one of the counseling process of deemed universities, the first choice of college which he entered was actually a 24 lakh rupees per year fees. When that particular college was allotted to him, he realized he cannot afford that college. Now what to do? He has not applied, he was not eligible for a government seat or any seat in his domicile state. He had not applied for any other private college in a different state. He had applied only for deemed universities. He was allotted a seat, but he realized it's not affordable. He had to come out of the counseling procedure, waste another year out of it, and then what happened to him? He lost 1 year. He lost his money also, what he had applied for the registration. These scenarios are very, very common. Marks certainly play an important role, but it is not just about the marks. It is about your planning, and about your budgeting also plays an equally important role for us. Finally, knowledge about colleges and documents. I will just share you one example. There was one student, while applying for submission of the choices in the colleges, He was attracted by the college just by its name. He didn't have an idea that this particular college, how good the college is, how good the facilities are there, or how good the faculties are there. At the same time, there was another student who took the help of a team of people from coach or a mentor team, and then she realized she did her studies. These are the colleges. I'm telling you, this first student which I'm talking to you about, he had better marks, he had a better rank, but because of lack of knowledge about the college, he landed up in a, I would put it as a C grade college, okay, and paying the same fees, which is another friend who, with the help of a team, could get into a better college. Both of them paying the same fees, but even after getting lower marks, she could get into a better college. Even after studying hard, he could not get into a better college just because of ignorance. And most importantly, the documents part of it. Friends, you all know that to get into a medical college, there are so many documents they ask us. And people think only after after the results get over, or when the results are out, I'm going to think about the documents. Please do not do that. Understand the importance of the document and make sure all your documents are well prepared and in your hands much before the counseling procedure starts. This will only help you to focus on the counseling procedures when it starts. You don't have to run around for the documents, and you know it is not very easy to procure all the documents. I'll tell you one more thing. There was one student who was actually an NRI, but his parents were from Maharashtra. In that whole scenario, he thought he's a domicile of Maharashtra, and he kept all the documents from Maharashtra ready. But unfortunately, when college was allotted to him and he went to the college, he didn't have the required document that he's an NRI. So he has to lose the seat. So past so many years, in the last 1 decade, we have seen people, because of lack of planning, because of lack of guidance, because of lack of budgeting, because of lack of knowledge about college and documents, even after scoring good marks, people have lost seats. And my dear aspiring doctors, I don't want this to happen to you. I request you that you please take help of a Career Shapers team who can guide you to get into a good medical college of your choice and of your budget. Thank you.